Hello, welcome to the Myhre Syndrome Summer Series. My name is Weizhen Tan, and I'm a pediatric nephrologist here at MGH in Boston, Massachusetts. As a nephrologist, I take care of children and adolescents who have kidney disease of all types. This can mean inpatient consults on children in the hospital, but mostly I see children in the outpatient or clinical setting, both in person and virtually due to the coronavirus pandemic. Dr. Lin has a wonderful overview and introductory talk in another video during the series, and many of my colleagues have detailed talks as well that you can view on different topics related to Myhre syndrome. If you are here, you must have questions regarding what the kidneys are as an organ and how the diagnosis of Myhre syndrome can potentially relate to you, your family member, or your child. By the end of this video, I hope that you will, number one, have an understanding of the basic kidney function and what it does for the body. Number two, how does Myhre syndrome affect the kidneys? Number three, understand what tests are available for us nephrologists to help manage and diagnose issues that affect children and adolescents with Myhre syndrome. And number four, finally, have some questions from the Myhre syndrome community answered. As you can see here from this picture taken from Wikipedia, I wanted to give you a general overview of the kidney. It is a bean-shaped organ that is located in your back and is located to either side of the midline or in your flank. The adult kidney grows to approximately 10 to 12 centimeters in size, but starts off typically 3 to 5 centimeters in an average full-term baby. As you can see, it is a very vascular organ and serves several purposes. The kidney has 5 basic functions. First, it helps regulate your volume status. This means making urine to maintain your hydration status. If you're dehydrated, it will decrease your urine output and hold on to what water you have. If you're very well hydrated, it will produce a dilute urine. Number two, the kidney helps regulate all your body salts. Your blood electrolytes such as sodium, potassium, and chloride all need to be maintained in a tight and steady range at all times in the blood. The kidney filters the blood to not just make urine, but also remove or reabsorb electrolytes and other products to ensure that the blood remains unchanged, also known as homeostasis. The kidney has also several hormonal functions as well. One of these functions includes regulating systemic blood pressure through the release of hormones including renin, which acts in the systemic renin-angiotensin and aldosterone pathway. Another function is to maintain good bone health by activating vitamin D from its inactive form, which is obtained from the sun and from your diet, into its active form. And lastly, it helps stimulate the bone marrow to make red blood cells to help prevent anemia, using a hormone or producing a hormone called epoetin. On the right, there is an excerpt from Dr. Lin's Myhre syndrome overview talk. As you can see, the renal conditions are mostly rare, but let me describe them in a little more detail. Most patients will come to us with issues regarding blood pressure. Myhre syndrome is known to have cardiovascular issues and aortopathies, meaning poor development of the aorta, which is the main blood vessel that feeds the rest of the body, including the kidneys. If the kidneys have poor blood flow, they react by producing hormones such as renin, which we discussed earlier, to increase blood flow to themselves as a defense mechanism. This results in an increase in blood pressure, and if there is a structural defect restricting flow, this will lead to a cycle of ever-increasing and harder to control hypertension that will require medicine and sometimes surgery to correct. Nephrologists such as myself can help diagnose, manage, and treat hypertension, as well as coordinate care with other specialists to help manage the cardiovascular issues. Primary renal disease is also rare in Myhre syndrome. In a small percentage of cases, there can be CACUT, which is also known as congenital anomalies of the kidney and urinary tract. These are developmental issues and can manifest in a variety of ways. They can manifest as structural issues, which in boys can result in problems regarding the urethral opening, such as hypospadias in the penis, or kidney hypoplasia or dysplasia, which is poor development of the kidneys. There could be kidney fusions or kidney ectopy, which is basically a different placement of the kidneys from their normal positioning. or even obstruction of urinary flow or reflux of urinary flow. As a sequelae of these congenital anomalies, these can lead to renal scarring due to urinary tract infections as a complication. And finally, other issues include bladder emptying due to poor tone, also known as neurogenic bladder, which may affect continence. You may also ask then, what are some of the diagnostic tests that we can use in kidney disease? Regardless of the underlying condition, there are several tools that we as nephrologists can use to assess kidney disease universally. This includes number one, ultrasound. Just like the ultrasound technology used in prenatal imaging, it uses radio waves to give good pictures of the anatomy and structure of the kidneys and bladder. We use it to assess shape, size, and the tissue parenchyma of the kidneys. It can also give us a good idea of what's going on anatomically, but it does not allow us to assess the function of the kidneys or test if there's issues such as obstruction or reflux. Another test that we use is urine testing, number two. These include tests like urinalysis, urine electrolytes, urine protein excretion. We can combine that with three, blood testing, which we can assess serum electrolytes and kidney function. And finally, we can use more specific imaging techniques such as CT scans, MRIs, or even nuclear medicine testing to give us a better idea when combined with the other forms of testing to see what's going on with the kidney. These imaging tests can assess for vascular flow or more functional issues such as assessing for obstruction or urinary reflux. And finally, we did not mention it very specifically, but there is a fifth type of test such as kidney biopsy that nephrologists can use. We use the kidney biopsy in rare instances when we need more detail by obtaining a piece of kidney tissue that we can look at under the microscope and also assess with special pathological stains. However, in patients with Myhre syndrome, this will be a very rare occurrence. We received several questions from the Myhre syndrome community, and I'd like to spend some time answering them. The first question we received is in regards to high blood pressure. High blood pressure can have a detrimental impact on the kidneys. Can you tell us more about this? Of course. Hypertension, if uncontrolled, like I said before, can lead to poor blood flow to many other organs, not just the kidneys. But if there's poor blood flow to the kidney, its function can decline over time. So as a result, the kidney likes to release more hormones to try to increase blood flow to itself. And in doing so, like I mentioned earlier, can create a cycle of ever increasing and harder to control high blood pressure. So as nephrologists, we like to focus on controlling the blood pressure. We like to manage the blood pressure first, and this will help protect the kidneys by preventing the cardiovascular outcomes associated with uncontrolled hypertension, which includes long-term stroke and heart attack. And lastly, in the adult world, hypertension can also be exacerbated by issues such as diabetes mellitus or obesity. And as a result, we like to focus on these other comorbidities to help prevent hypertension and its associated long-term effects. The next question asks, what should parents look out for when it comes to kidney function and potential signs of a problem? This is a good question as well. As pediatric nephrologists, the main things we look out for, or ask the parents to look out for, is in regards to growth. If there's chronic kidney disease and poor kidney function, the electrolytes are abnormal, the pH balance may be off, there may be issues with fluid overload. Children cannot absorb nutrients and grow well when the kidneys are not functioning well. So I think if growth is not up to the standard for your general primary care pediatrician, or if you look at the growth chart and there's not good growth velocity or weight gain, that is something that is a sign that maybe we as nephrologists need to focus more on the kidneys. Other than that, nephrologists focus on blood pressure, protein in the urine, and of course your electrolytes and kidney function, which require medical monitoring. So as long as you're in the care of a nephrologist, parents can focus on growth. And of course, if there are congenital anomalies of the kidney and urinary tract, we may assess or ask parents to monitor for urinary tract infections, as these can also be a sign of congenital kidney disease. If the children are old enough to say that it hurts to urinate, then we may use other subtle signs in children to assess for urinary tract infection. This includes fever with no other symptoms, poor activity level, poor feeding, increased tiredness or fussiness, or what I like to call using parental intuition to assess for signs and symptoms for them to bring the child in for evaluation. The next question asks, should myri children and adults be getting renal imaging or renal function studies regularly? I think that baseline studies are useful to assess for anatomy and rule out any congenital issues, so baseline ultrasound may make sense. Serum studies can also be done if they're already being done for any other specialty. If there are no specific renal issues, such as blood pressure or other congenital anomalies, I do not think that blood work has to be regular. But I do think that a blood pressure check and a urinalysis is not hard and a reasonable thing to do at yearly visits with the pediatrician, for example. And lastly, how might losartan or other medications those with myri syndrome are frequently on impact the kidneys? Well, I'll focus first on losartan. Medications like losartan, which is an angiotensin receptor blocker or ARB, are often used in blood pressure control. They are very impactful for the kidneys if the side effects are not addressed or monitored, but otherwise they are fine for the kidneys, even with patients who have chronic kidney disease. The dosing of losartan and other ACE and ARB drugs are based on weight, and in children we use weight-based dosing to make sure it is an appropriate dose. And we always counsel our patients on side effect monitoring. This includes monitoring for urine output when the patient is dehydrated, because ACE and ARB classes of drugs work by reducing renal blood flow. So if the child is dehydrated, we do not want them to continue taking the medication as it can exacerbate acute kidney injury. We also make sure that the patients have their blood pressures monitored, because the side effects of these classes of drugs may be to lower blood pressure as well. And of course, by reducing renal blood flow, there's less filtration of the blood, which means electrolytes like potassium may be increased as well. So as long as we monitor side effects, these medications are usually very well tolerated and can actually protect the kidney function long term. And for any other specific drug and relating to kidney disease, we will always counsel our patients on side effects, on dosing, and issues for monitoring that parents need to look out for and bring to the attention of their medical provider, either their primary care pediatrician or their nephrologist, should any concerns arise. I hope that I've answered some of the questions today regarding kidneys and myri syndrome and how they are related together. Please feel free to reach out to the Myri Syndrome Foundation if you have any questions or concerns. I'd be happy to answer any questions offline. Thank you for listening to this talk.